Hypertension is the most common problem among Indians. Blood pressure or hypertension is the force exerted against the walls of the arteries with the pumping of the heart. It is recorded with two numbers, for example 120 by 80, where 120 is the systolic pressure, that is the pressure exerted when the heart contracts, and 80 is the diastolic pressure when the heart dilates. If the blood pressure is more than 140 or 90 on three occasions, then it is said that the person is suffering from hypertension. Sometimes there may not be any symptoms, but regular monitoring is important. The artery walls become thick because of the deposition of fat, cholesterol, and other substances over a period of time, and this interferes with the pumping action of the blood. So the pumping of the heart becomes harder and it raises the blood pressure. And the high blood pressure damages the artery walls. So it is better to keep the blood pressure under normal to prevent the damage of the arteries. Hypertension is the major risk for stroke occurring at older age and people with higher body mass index and ethnicity. Two dietary influences are related to hypertension. One is lower intake of calcium, magnesium, and potassium, and high salt intake. For normal blood pressure, limit salt intake, maintain ideal body weight, and limit alcohol. If the blood pressure is between 120 by 80 and 130 by 90, then it is said to be pre-hypertension, and care should be taken by exercising more and taking good diet. If it is mild hypertension, the sodium restriction should be 1000 to 1500 milligrams in cooking or on table, and include more amount of potassium, and the potassium rich foods are fruits and vegetables. So regular exercise and stress management are important. A DASH diet or dietary approaches to stop hypertension is to be followed, where there are 7 to 8 servings of grains, 4 to 5 servings of vegetables, 4 to 5 servings of fruits, and 2 to 3 servings of milk. Include more fish and low fat milk and have more vegetables. All plant foods have low sodium and animal foods have high sodium. High sodium foods are processed foods, salted fish, salted snacks. All these